This is the injury report presented by NYU Langone Health. Knicks guard Deuce McBride missed his fourth consecutive game because of inflammation in his left knee. So in today's injury report, we have Dr. Michael Schwartz, sports orthopedic surgeon at NYU Langone, to help break down the injury and to give us somewhat of a timeline on when Deuce can get back on the court. Doc, how are you doing today, man? Thanks for hopping on with us.
All good. Thanks for having me, Brandon.
All right, I'm locked into this one because I think I got a little knee inflammation on my knee from playing hoops at the courts in Hoboken the other day. So this one's more for me than Deuce. First question, how do teams manage knee inflammation, and what sort of treatment is going to be available for Deuce?
Well, first of all, knee inflammation, in simple terms, is the body's response to injury, which occurs as the body releases chemicals to heal damaged tissue. Hallmarks of knee inflammation include pain, swelling, stiffness, sometimes a clicking, popping sensation, and redness. Inflammation can be within the knee joint or it could be on the outside of the knee joint, affecting the tendons. So it's diagnosed based on a thorough physical exam and sometimes imaging. Now, as far as managing knee inflammation, it's generally treated with activity modification and generally requires complete rest, ice, and anti-inflammatory medication. So, Brandon, if your knee's bothering you, you need to rest. You need to stay off it.
Ah, that's too bad. There's a lot of people in Hoboken that's loving that diagnosis because they don't want to get dunked on today, Doc. Nah, I'm kidding. It's raining outside. But he hyperextended this knee back in October, and he played 9 games with it wrapped. So you think that could have contributed to the current knee inflammation and the pain that he's dealing with now?
It sure could. I'm not privy to the details of the injury, of course, but when McBride hyperextended the knee, he bent it backwards beyond its normal limit. And a hyperextended knee is a type of sprain. Due to this type of injury and damage, it typically creates pain, swelling, stiffness, characteristics of inflammation. Now, the fact that he continued to play most likely did exacerbate his symptoms and didn't allow it to heal. And the knee wrap that he was wearing was really of minimal benefit.
You talked about him needing time to heal. Let's say he were to play tomorrow after being out for 4 games, do you think that's rushing him back too fast, especially with it being so early in the season and on a joint that gets so much impact in a sport like basketball?
Look, the NBA season, as we know, is a really long season. It's 82 games plus all the practices. So it's definitely best to have Miles rested until he's fully healed, until he feels better so he doesn't have further injury. You know, the knee absorbs a lot of high loads playing basketball between the running and jumping, and there's no substitute for rest in order to get him back on track.
Let's say he gets rested, he gets cleared to return back to the court, he's playing well. Is this something that he and the team need to worry about in terms of he could regress or something worse?
This could definitely worsen and become more persistent if it's ignored, and then become more of a difficult problem to treat. So very important to catch it early and treat it appropriately. Now, it's also certainly possible that he has some other damage in the knee causing his continued inflammation. Aside from a comprehensive exam, imaging is often necessary, such as an MRI, to really determine if there's any further damage and to apply the appropriate treatment after getting the MRI.
Okay, Doc, so he may miss some significant time in terms of to get this thing healed and to get 100% to get back there on the court and not kind of take a step back. $1 million question, though, for you, Doc. Is this common in non-athletes? And how does treatment differ for people not playing a professional sport?
You know what? Everyday players, weekend warriors, it's all the same. When you have an issue like this and you try to play through it, you wind up in my office complaining that your knee hurts and it's not getting better. And, one of my mainstays of treatment is really just convincing the athlete to, rest it a little bit to get back on track. Because when you ignore it, it really becomes more persistent and harder to treat.
Okay, you guys, you hear Doc? If you want to get back on the courts with me and you hurt your knee, make sure that you give it time to rest, or you're going to come get dunked on and you're going to hurt it even more. Not true, Doc. I'm 40. I don't have the bounce like I used to back in the day. But thank you for coming on and breaking this injury down for us.
My pleasure.